Yes.
Hi, everyone. This is Tammy Patzer, and today we are going to be talking with Dr. Usha Mantha about non-alcoholic fatty liver disease. But first, let me tell you a little bit more about the doctor. She has a beautiful clinic in Upland, California called Verb, where she specializes in weight loss and laser aesthetics. And she also has an extensive background in OB, gynecology, family medicine, and she's board certified in family medicine and obesity medicine. So that's just a little bit about Dr. Mantha. Let's start with the question, exactly what is non-alcoholic fatty liver disease?
So, good morning. Thank you, Patty. So, non-alcoholic non-alcoholic fatty liver disease. So you may have heard some people would say, oh, I have developed cirrhosis, or my mother or my sister has developed cirrhosis, and they never even ever touched alcohol. So that is precisely what non-alcoholic liver disease means. So non-alcoholic fatty liver disease means that the fat that we ingest when it is in excess of what we can burn, as it accumulates in our body parts, it also accumulates in the liver. Now, liver being a very sensitive organ for a lot of metabolism that happens in our body, it's a big organ and it is the main functional area for the metabolism. So that metabolism is affected because of these little fat globules that are actually inside the liver cells. These fat globules over the time become inflammatory, and then they can cause pain, but what they do cause is more of fibrosis, which is adhesions, and these cells slowly are not functional. So now, first you start with accumulation of fat in the liver cells, then it can cause inflammation, then it causes something called steatosis and fibrosis, and eventually cirrhosis. And cirrhosis of the liver is almost like end-stage liver disease, which can ultimately also can cause liver cancer. So you can see non-alcoholic fatty liver is simply accumulation of excessive fat in the liver cells.
So it can be quite serious then, even though you may have never had anything to drink, because most people think that liver disease is from alcoholism, but it's really not. So how common is non-fatty liver disease?
So good question, because non-alcoholic fatty liver disease is becoming more common. The two main driving forces why we are actually now bringing the awareness for non-alcoholic fatty liver disease is because of two reasons. Number one is obesity or overweight, and second is diabetes, which are all actually all go hand in hand. So the prevalence is increasing, and it's up to 30% of adult population. So you can imagine 30% is a high percentage. So up to 30% of adult population have a non-alcoholic fatty liver disease, either in the beginning stage or in its advanced stage, in different stages. So it's very common.
So when you talk about stages, I take it's like stage 1, 2, 3, 4. What are those stages, and what would the significance be related to those stages?
So that's a good question, because we are talking about non-alcoholic fatty liver disease because as physicians, as weight loss experts, as primary care physicians, or even specialists as gastroenterologists, we believe that this is a lifestyle issue. It's related to a lifestyle issue, this chronic disease. So let us think about what are the stages. So there is liver. We ingest fat. It goes through our stomach and gets absorbed into our system. So in the original stage, there is only a little bit of droplets of fatty tissue in the liver cells. So that is the early stage. The next stage is when it causes inflammation. So how it causes inflammation? The fat cells are inflammatory cells, and that we have absolutely confirmed now. And we have to be very, very confirmed, Tammy, that we know anywhere the fat cells are, they are inflammatory anymore. Higher the percentage of fat cells, the more inflammation. So the inflammation is red hot and tender. Whenever the inflammation happens, that inflamed tissue will cause what is called as adhesions and fibrosis. Whenever there is a healing happens, inflammation happens. Healing is by fibrosis. So first there is fat cells accumulate, that's one stage. Second stage is when the cells are inside the cells, inside the fat cells are inside the cells and they are expanding and causing inflammation. So that is called NASH. It is non-alcoholic steatohepatitis. So hepatitis is now happening. Then there is fibrosis, next stage. And after fibrosis, because fibrosis is fiber, it's a hard tissue. It is not metabolically active tissue. Now the liver is not functioning. Now liver will cause liver dysfunction, which is cirrhosis. So starting with non-alcoholic fatty liver disease is simply that. Next stage is NASH, which is NASH with inflammation. Next is fibrosis, then liver cirrhosis. Once cirrhosis happens, liver dysfunction is at its maximum. It can cause you metabolic disorder, it can cause bleeding disorder, it causes multiple things. It can, eventually lead to liver failure, kidney failure, heart failure, and of course, death and dying. And those people who don't have death and dying from cirrhosis and its secondary effects of cirrhosis of bleeding and infections, they can develop hepatocellular carcinoma, cancer. Any cirrhosis can eventually cause cancer.
So it's a progressive type of disease, and basically cirrhosis means that the liver is dying or dead. So
almost functionally.
So how would you go about finding out if you have this? How is it diagnosed?
So like many other diseases, Tammy, it is a silent disease. However, it is let me also talk about what age range. So let me put that etiological factors so we know who to look for. So it is common, it's more prevalent in after age 40 or 45. And this is also the time when we diagnose our overweight, obesity, diabetes. They are all prevalent after 40 or 45 years of age. And all these metabolic, sort of syndromes go hand in hand with non-alcoholic fatty liver. So that is the age group that we are diagnosing this. Second is the Hispanics traditionally have more weight, so it's more common in Hispanic population. And so that is another. But we have also seen it's getting common in females, though the ratio, according to the books or studies, are like men and women equally can get it. But in my practice, I have to tell you, I have 10 women that I have diagnosed with non-alcoholic fatty liver disease. So it is, some places the women have more than men, but it's equal in both men and women. The next thing is etiologically, Asian women, for some reason, have a little bit more prevalence of non-alcoholic fatty liver disease. So in the diagnosis, number one is we look at the etiology. Number one, we look at the risk factors. So these are all risk factors: age, sex, equal, men and women, whether you are Hispanic or Asian women. So that is another, risk factor. Other things are if you have diabetes, if you have hypothyroidism, if you have thyroid disorder, you are high risk. If you have had a cholecystectomy for some reason, you have a high risk of non-alcoholic fatty liver. Then you have, so these are the categories. And basically, it's an asymptomatic disease. However, so how do we diagnose? We do a blood work. I often tell my adult patients that when I'm ordering a blood work, I'm looking at their blood count, liver function, kidney function. And the liver function, there is one enzyme called ALT. It's alanine transferase. That enzyme is invariably elevated with non-alcoholic fatty liver disease. almost 100% of the time. However, we say that it's not necessary to be elevated, but in my practice, I almost see 90, 95 to 100% time it's elevated. So there is a little blip in an enzyme of your liver that guides us to say, we must look for non-alcohol fatty liver disease. We must look for an ultrasound, and then we go ahead and diagnose with CT and MRI. Once we see that elevated liver enzyme, we go ahead and do further testing. We have to make sure it's not related to medications. Some of the common medications like metformin and some statins can increase the liver enzymes, so we must check it's not because of medications. We should check that it's not because of alcohol intake. We also have to exclude any hepatitis per se that can cause enzymes to go up. So the way to diagnose is, number one, we find the risk factors, okay, the ones which we talked about, whether there's male, female, which ethnic background. Number two is, are they taking medications? Number three, they're overweight and obese. Then we go ahead and do the exam, and then we do the blood test. There is a small proportion of people who will present with fatigue and malaise and have some right upper abdominal discomfort when the liver is going through the steatohepatitis stage. Because inflammation is happening, they are not feeling well. The stage we talked about between the fat being accumulated and the cirrhosis. During those times when there is inflammation, one can actually do have fatigue, malaise, and upper quadrant pain, not tolerating fatty food, just not feeling well. So that is another stage when we can, pick these patients, do a blood work, do an ultrasound, and diagnose it.
So with all that, is it something that is treatable and reversible? Is it something? And I also wanted to clarify, when you talked about hepatitis, is the term hepatitis, I always thought that hepatitis was a virus, but it doesn't sound like that's necessarily accurate.
Right, so that's a great question. So word hepatitis means inflammation of the liver cells, period. How or what causes that inflammation is what we are discussing. So clearly, the common causes of hepatitis, or the ones which are more obvious, are infections. And those category are your hepatitis A virus, B virus, and C virus. So yes, you are right. Viruses are number one that affect the liver. Liver is less common to make a bacterial abscess in the liver, because liver is an organ that really deals with viruses as soon as virus hits the body. So they do get more attacked, liver does get more attacked from the viruses. So that is one type of hepatitis. That is a cause of inflammation. When we exclude those causes, second cause is alcohol. Alcohol also causes hepatitis, also causes liver disease, cirrhosis, and lead to liver cancer. So and then the medications. Some of the medications can be toxic to the liver, and they can also cause inflammation of the liver. So yes, the word hepatitis is a big umbrella. One of the causes of hepatitis is non-alcohol related fatty liver changes. And the reason the liver attracts the fat is because all the carbohydrates we ingest, they are all working towards changing into fat and putting it back in the liver. They are actively working. So next time you eat a candy, remember, it's changing into fat and getting into your liver. So no candies for adults. So because we don't metabolize this fat, we don't metabolize the carbohydrate. And carbohydrate is number one cause why we are getting heavy. Everywhere we turn around, there is a piece of carbohydrate ready to be, ingested, ready to be eaten by us. So that is how the word hepatitis is attached to non-alcohol fatty liver.
So if I go to my doctor, what kind of questions should I be coming up with, just in general to make sure that I get checked for these types of things?
So very important also is that, so all adults in general should start with, regular physicals. And they should definitely discuss with their, doctors about whether they are average weight, and they should have a blood work. Because like we said, blood work is, there's the first test which sometimes shows that there is liver, fatty liver is happening. Also, before I forget, though we emphasize that, fatty liver is prevalent in only overweight and obese patients, but normal weight diabetics can still have fatty liver changes. Normal weight diabetics. This is why it's highly important that we diagnose this by doing a blood work, a liver function test, very simply. So adults, those who think they may be at risk, or those who do want to get screened for this, they should discuss with their primary care doctor and get a liver function study done on their blood test. If that blood test shows any, elevation in liver enzymes, then their doctor should do a full physical exam and examine their liver. Once in a while, I have a patient who has an enlarged liver, and that is the first sign of liver getting bigger from fat accumulation. So they should have a blood work, a full comprehensive exam, and discuss the results with their doctor. So if they are having diabetes, if they have high cholesterol, if they have had thyroid disorder, if they have gallbladder removed and feeling like there is something not right, I always order ultrasound of the liver, which is then followed by an MRI of the liver. And that pretty much does the preliminary diagnosis. Confirmation of whether they absolutely have any further changes than just fatty liver, like we talked about steatosis or NASH or inflammation, they have to have a liver biopsy done. And liver biopsy is become very safe anymore. It's done with a fine needle and under ultrasound guidance. A little bit painful procedure, but nothing major. It's done in the radiology department and the results are available within 1 week. So that is, that is the whole range of what needs to be done to diagnose it.
So over time, then the damage that can be done, obviously, as it goes through the different stages, and then of course it could lead to liver cancer. What is the life expectancy? Like again, I guess, does fatty liver turn into cancer, or is it just some people get cancer, some people don't?
So yeah,
all that
that's an important thing that we need to talk about, is that what's the course of, or what is the prognosis over 10 years and 20 years? Very fortunately, this disease, non-alcohol fatty liver disease, it's now coming, like I said, it's becoming much more, the awareness is coming now, because we have not known about it in the past, like 20 years ago, but we now know about it. So we are able to prevent the progression of it. It's not rapidly progressive disease. It's a curable disease. So if we are in the very early stages of fatty liver changes, we are absolutely 100% able to reverse it. The stage that becomes less reversible will be the cirrhosis stage. But there is up to 15 years time between very initial diagnosis of fatty liver changes to developing inflammation to become cirrhosis. Unfortunately, when we do not catch this disease in the early stages, and someone comes in and their liver enzymes are like 5 times high, and they are having symptoms. They are like losing appetite and their legs are swelling. Now they are showing signs of liver failure. That is a very advanced stage. So we do have up to 10 to 15, 12 years. It's not progressive if you can treat it. And we will talk about, in detail of prevention and treatment. It will not progress to the inflammatory stage and cirrhosis. So let us say it's about 15 years. There is a lead time. It's only if we didn't diagnose in 15 years, then their life expectancy may be about 5 to 10 years, max 5 years.
Well, then the good news is that if you're somebody who's going to your doctor and you're aware, you can actually stop it. So let's say, I guess we can either start with how to treat it or how to prevent it.
Yes, that's the whole question. So let us talk.
Whichever one you would like.
Yes. So like I said, treatment for liver disorders is something that mostly we end up doing treatments for the sequelae of the full-blown disorders. So we would like to talk about prevention, okay, and cure in the early stages. That's the one thing I really want to emphasize, because that is where my expertise comes in, and that's where I'm passionate about. So let us talk about what are the things that are proven for the treatment, or not treatment, prevention of progression of non-alcoholic fatty liver disease. So most importantly, there are two parts of this treatment that I'm going to emphasize heavily. So number one is lifestyle changes and dietary changes. Absolutely necessary. And second part of this is exercise. The benefits of these two major changes is, of course, weight loss. So the three things that we absolutely are saying is lifestyle change to change your dietary habits, lifestyle change to increase your exercise, and leading to weight loss. Let's talk about each of these. So the number one is our diet. And I'm very big upon this because, we now have proven, like I was mentioning before, that in order to prevent the fatty liver to progress, we have to increase our protein in our diet. And we have to absolutely reduce our carbohydrates no matter how we do it. We know carbohydrates directly cause fatty cells to grow. They directly cause old cells to not die. So they actually stop from destruction, and they actually increase the cells of the size of the fat cells. So we know carbohydrate does three bad things. First, it actually increases the size of the fat cells. Second, it actually increases the production of fat cells. And third, it stops them from dying. But if the old cells do not die and clear off of our body, they become toxic for us. So we know carbohydrates does this thing. So number one dietary change will be reduce carbohydrate food for treatment or prevention of fatty liver. Second is protein. We do want you to consume protein in moderate amount, which will be about 30 to 40% of your calorie intake a day. So which is about 70 to 100, up to 80 to 100 grams of protein per day. That protein, again, there are two types of protein. One is of animal origin. The second one is of plant origin. There has been studies that hypothesized that animal-based protein was not as good as plant protein. However, we have come to a conclusion that we should just reduce the amount of animal protein and increase the plant protein. Either way, the protein itself with its branched chain amino acids and stuff will help the liver not to accumulate fat. Okay, so we need to increase our protein intake. In the protein intake, try and increase the plant-based protein and more than animal protein. So that is our protein intake. Now, the third one is the fat. That is the macronutrients. The three main things is carbohydrates, fat, and protein. So we talked about carbohydrates. talked about protein, and the third one is your fat. So the fat intake now has to be absolutely, you have to learn how to look at the labels, and we can talk about it in detail another time, about mono and poly unsaturated fat. The way the Western diet is today, we are going to In-N-Out burgers, we are going to Taco Bells, we are going to, other places, and we are eating a lot of saturated food. Western diet is loaded with saturated fat. Saturated fat has to go zero. That is the most important prevention part in the fatty liver. So the three main macro ingredients: carbohydrate, protein, and fat. And those are the three important things. In the fat, we have to reduce the saturated part of the fat. Just for a layman thought, saturated fat will become solid on room temperature. Okay, so any of your butter, your lard, or any other oils that actually become white when they are standing up on your counter is big no-no. Okay, so that is mainly the diet. Three main types of things for the diet. So next comes your exercise. Exercise is absolutely must in order to lose weight and to improve the liver function, absolutely necessary. And I just want four things about exercise. It should be done almost every day, if not 3 to 5 times a week. You can skip 2 days if you want to. Number two, it should be done 30 to 60 minutes. Start with 30 minutes, keep adding 15 more minutes per day if you can. Number three, it should be moderate intensity. So if you're taking a stroll up and down the road, will not work as much as you jog a little bit. Now, for those of people who are overweight, obese, have heart disease, and they should consult with their doctors before they actually get onto the treadmills. However, they can slowly increase their pace. If they are walking slowly, they need to fast walk. So that is a moderate intensity exercise. And number four is, it can be either aerobic or strength. It doesn't matter which type of exercise we are doing for fatty liver, because the studies have been done on all kinds of exercise. So we don't mind if you are on a treadmill, strengthening your heart, or you are doing your weights. In general, the weights are only done every other day for those who are not regular weightlifters, because we need to rest our muscles in between. So the strength training can be up to 3 times a week, but your regular aerobic exercise or running or moderate type, that can be every day. Is that kind of right? So 4 things: daily exercise, moderate exercise, 30 to 60 minutes, and it can be a combination of aerobic and resistance training. So that is about exercise. Studies after studies are showing that number one treatment for non-alcoholic fatty liver disease is weight loss. 10 to 15% loss of your body weight from your baseline will actually reverse the changes of your fatty liver. And so those are the key. Almost 100% of the time, these will fix it. Next comes, so this is your diet, your exercise, and lifestyle change. Next is some supplements I want to talk about. So like I said, liver is the metabolic, warehouse of the body. So everything we take, everything we put in our mouth goes practically through the liver. And liver is very active and has lots of enzymes. It's a big organ, takes long time to damage it, but once the damage starts, unless we fix it, it can be progressive. So let's talk about supplements. So few supplements that we recommend is one of them is herb-based called milk thistle. You may have heard about it. It has antioxidants, and it's over the counter. And it's the RDA, the over-the-counter dosage is enough for taking milk thistle 1 or 2 pills a day. Number two, some of the other things that have been studied a little bit that supports liver is some zinc, up to 8 to 11 milligrams a day for men and women. And then selenium in about some micrograms, 300 or so micrograms. And then vitamin E. Now, can be given for liver dysfunction. However, with vitamin D, the one thing we have to be careful is it does have two types. One is natural from natural food, which is beneficial, but the synthetic one has more isomers. So one has to be consulting their physicians before they want to take synthetic vitamin E, because it can have a little side effect of prostate cancer. So vitamin E, consult your doctor, take your bottle to your physician, show them, consult them, and then let them decide whether you should take it or not. So, but milk thistle is easy to take, and your selenium and zinc in small amounts is easy to take. So those are the supplements. So now, more definitive treatment, absolutely definitive treatment that has been studied is more invasive, and that is your bariatric surgery. So bariatric surgery is, of course, your gastric bypass surgery and your gastric sleeve surgery and so on and so forth. Those surgeries are definitely have shown that non-alcoholic fatty liver disease in patients whose BMI is above 40 reversed all these changes when they studied these patients at 1 year, 2 year, and 3 years. So that is the most definitive treatment that, if you call treatment, like we talked about, what is the treatment? So I would suggest that bariatric surgery is the final treatment. However, that is most definitive. But of course, bariatric surgery is a very invasive process, very involved process. It changes lives. So, but that is the definitive treatment. So in summary, weight loss 10 to 15% by changing your diet, exercise, lifestyle changes is absolutely proven to reverse early stages of non-alcohol fatty liver disease. It's also seen to reverse and to stop the progression from fatty liver to NASH to cirrhosis. So your best treatment, first and foremost, is weight loss. Absolutely. Next is supplement. And if those do not work or doesn't happen and the weight keeps going up, then bariatric surgery.
I'm listening to this, and it sounds to me like one of the best things that any of us can do is that, like you just said, lose weight, exercise daily, and eat higher protein, less whatever the
less of saturated fat.
Saturated fat.
Yes, saturated.
And so you mentioned reading the labels for different types of fats and different things like that. Because, I mean, if you think about it, it sounds like it is 100% preventable just by if you were to eat right to begin with, and then, of course, to reverse it. And at least you do have some time, between how the progression of it. But I think one of the things you pointed out that was important is for people who don't have a gallbladder, who may have had gallbladder surgery, they need to pay attention to that. And then people who have the thyroid issues, all of those things I think are important too. And the main thing is to talk to your doctor, have these conversations, get the blood work done. And I always, look at it that we all should be looking at our blood work, and if our doctor, isn't the right doctor, find a doctor who will talk to you about all of this stuff, and so that you can have prevention. So you talked about milk thistle and vitamin E, zinc, and selenium. And I've heard of milk thistle before as a liver support. Is milk thistle, does it detoxify the liver, or is it just like a support for the liver?
It's a detox. It's a main ingredient in most of the detoxes. So it does have a detoxic. It's at the cellular level, it does help cleaning the, so the way the cleaning happens in just general term to understand is, like I said, the liver is a big factory trying to, sort of sort out all these garbage that comes in inside the body. So it's trying to decide kind of thing, what to keep, what to let go. So when antioxidants we take, then it just says to us that, we should keep this material, discard this. So it helps to do that particular function in the liver. It's guarding the liver cells against all the toxics that we ingest for the body. So it's an antioxidant, and it helps oxidation in the liver. Two things I would like to also add to this is, it is a small proportion of people are genetically actually predisposed to this condition. They have seen a gene called PNPLA3 polymorphism can be present. And in fact, I have to tell you a small story. The number 2 patient of mine, I've known her for a long time. Her blood sugar started rising. So another key thing is that if you are a diabetic, you absolutely have to ask your primary care or some physician, do I have non-alcoholic fatty liver? Doctor, do I have fatty liver? Can you please check? Because in diabetes, it's almost 95% of them will have it. And it's just the way the insulin sensitivity is causing this. So diabetics will absolutely have some amount of fatty liver. So, and it could be the cause or the effect of diabetes and insulin sensitivity, because the insulin resistance situation or condition that diabetics have, they are very highly predisposed to fatty liver or fat being accumulated in the liver. So it's very important. So the story I was telling you is about the number 2 or 3 patient of mine who I've had for a long time, and her liver enzyme went up. So I called her into my office. I said, I'm doing this study. I want you to take this. And she started crying. I'm like, what happened? She said, doctor, you and I have met so many times, and you have asked me family history, in the beginning. And she said, I never told you, but my father died of cirrhosis at age, 50. And I'm like, really? And she's about 38, 39, or maybe 40, maybe early. And I'm like, oh. And she said, doctor, my dad never drank. So she asked me, but her father was in India, and I am not aware of how, she's with me. So I did offer her that she could go to a tertiary center and get the gene testing done. But the outcome, she said, I said, we discussed, any test we do, we really need to know whether it will help the current patient or not. So she decided not to have the gene tested. However, she started crying because she said, oh my gosh, Dr. Mantha, you found it, and now you're going to help me do this. I'm so grateful. So when I started doing this, I'm telling you, I am now myself have learned so much and evolving, and I'm learning from my patients every day. So it can run in the families. If you have a person that died early from cirrhosis and you said, oh, they never drank, what happened to them? Because cirrhosis, for laymen, for in general public, we think cirrhosis means drinking alcohol, right? So soon as somebody says cirrhosis, we say alcohol, because that is the common, and that's the commonest reason, because it's more, socially acceptable, alcohol drinking. But most of the alcoholics will die of a fall or liver failure. But this condition exists in non-alcoholics. These patients have never drank. However, along with the ALT, the enzyme we talked about, there is another enzyme called gamma GT, which can be elevated also in these patients. So with non-alcohol fatty liver. So when we check the liver enzyme, it's ALT and gamma GT. We check both. And if you have a family history, then it's also important that we do that. One more question that I did not cover, and people ask me, if they have liver disease, can they drink? Should they drink? Will that add to the damage? The answer is yes. Some people have said no, they are two different etiology, but as a general person, as a primary care physician, and as just from our experience, I find that if they have one insult to the liver, they don't need to add more of the insult in the form of, medications and alcohol, specifically alcohol, because it's a social habit, it's a social activity. So if they can't stop drinking, they at least have to cut back. And our recommendation is, for women, just 1 wine per day. For men, not more than 2 wine per day. In other words, if you're drinking other type of alcohol, it's called standard alcohol unit, which is about 14 grams of alcohol. And in a week, men can have 21 and women can have 14 units of those. So basically, it comes down to 1 wine and 2 wine practically, not more than that a day, because that can add to the, toxicity of the liver. And certainly there are some medications we have to absolutely avoid, and that list exists, and as physicians we'll take a look and guide accordingly. So yeah, that's pretty much.
So basically it's really important that you talk to your physician to find out exactly what is going on, because it's not something like somebody could just look at you and say, yeah, that's what it is.
Yeah, no.
You have to do the blood work.
And not only that, you should be asked, if your doctor is not aware of the condition, you have to request to see someone who's a specialist, either a gastroenterologist, and then somebody with weight loss experience who has weight loss. Like us, I am a weight loss expert. And I'm looking for these patients. I'm looking to sit with them. I'm looking to counsel them and give them data and show them what food they should eat. How should they eat? How should they start their exercise? What needs to be done? I see them on a regular basis. I see them once a month and sometimes once in 2 weeks. And we will discuss it. And then I'm able to check the blood test on them every 3 to 4 months and see whether these enzymes are going up or down, and MRI of the liver once a year until it settles down. And the MRI, they actually look at several things in the liver. They will look at the different stages, and they give a very detailed, analysis. And if they have doubt, like suspicion that it's more, then they order biopsy of the liver. So if you go to a weight loss expert, they will work with you. And all it's needed is 10 to 15% of your weight loss, of your current body weight, which is not a lot when you do it therapeutically, and it is a lot if you don't put your mind to it.
Right. Well, let's say if you weighed 200 pounds, 10% would be 20 pounds.
Which is...
And you think about it, that's not that much. But the difference between 180 pounds and 200 pounds is a significant amount, especially depending on how big somebody is to begin with. So, but it's interesting because sometimes I don't know that people realize that somebody who is a weight loss or obesity specialist, that they have all that specialized training related to obesity and all of the other diseases and things that go along with having all that extra weight. So I think that's really good information. So before I let you go, is there anything else that you'd like to add?
I think that we have talked about it being, non-alcoholic fatty liver disease. 30% of adults have it. It's a progressive disease. It can be cured in the early stages. It can be treated by weight loss surgery. However, 10 to 15% weight loss is enough. You should see a weight loss expert. And if you want me to help you, so I am a weight loss expert, and I love to treat you and talk to you and counsel you and get you, give you all your answers. And my website is vervemedspa.com. And I also have joined forces with a company called Designs for Health. It's been there for about more than 25 years. And they do the best supplements as far as I understand. And the beauty about this company is they actually have all their ingredients, every single ingredients listed, and how they prepare and what are the things and what benefits. And I recommend that you go to this web store and look up for your liver support. And all their, like I said, all their supplements are listed very cleanly and in detail. And the address for that is drmantha.ehealthpro.com. So it's drmantha.ehealthpro.com. And this place, you will get so much knowledge about all your supplements. And specifically, if you are trying something like milk thistle, I recommend that you definitely start that. The vitamin E, it's one of their most popular medication. But if you feel confident, you can try it. If you want to discuss with me or discuss with your primary care doctor, of course, you can get in touch with them. Otherwise, my number is 909-377-2939. And good luck.
Well, thank you so much. I've learned a lot, and it's something that I think everybody needs to really understand, that non-alcoholic fatty liver disease is something that we all need to pay attention to. And it can all start with a simple being able to read that blood work and know if your liver enzymes are elevated or not. And that can at least start leading you to some answers. And definitely contact Dr. Mantha about this, because she is a weight loss expert. And as you can tell, she just gave us pretty much everything you'd ever want to know about non-alcoholic fatty liver disease. So thank you so much. I really appreciate it.
Thank you so much, Tam.
Everyone, this is Tammy Patzer. Go make it a beautiful day.